Welcome to the University of Utah Neuroanatomy Laboratory. We're going to go inside and do some dissections of the brain and look at some of the important structures that are useful for understanding neurological principles and localization. The purpose of neuroanatomy and all of its tortuous tracks is to allow you to do neurological localization. That is to say, decide where in the brain of your patient the disease process is occurring. That's the total reason for most of you to want to understand the connectivity of the brain. Now let's look at the surface of the brain. We've removed the coverings, the leptomeninges, the pia, and the arachnoid, and I want to just show you the different lobes of the brain as an introduction. In addition, on this brain, you can see the brainstem. The brainstem extends from this region where my probe is, a little bit difficult to see, down all the way here to where the spinal cord was attached. In addition, you can see the cerebellum involved with coordinated motor control, as well as the surface of the cerebral cortex. This is the ventral surface of the brain, and the most prominent feature here is the temporal lobe, which I am outlining. Here is the temporal lobe on the other side, and in front of it is the undersurface of the frontal lobe. Cranial nerves are attached, such as a visual optic nerve and the sensory nerve from the face, the trigeminal nerve, and blood vessels, such as this large basilar artery, are running on the surface. Or you can even see the large internal carotid artery. We will come back and look at the nerves and the arteries and the other connections in greater detail. But I just want to introduce you to the region of the medulla, the pons, and the midbrain. And together they make up the brain stem. Let's look at the surface now of the brain and look at the different lobes. You already saw the inferior surface of the temporal lobe coming back to here, and we just kind of arbitrarily draw a line and say that this is approximately the end of the temporal lobe posteriorly and the tip of the temporal lobe anteriorly. And then we look for a sulcus on the surface of the brain. Sulci are these grooves, and the surface structures that are coiled are the gyri. So we have sulci and we have gyri. The gyri have names, but we're not going to learn most of them. However, this major sulcus, the central sulcus, because it runs from the midline all the way down to the lateral fissure, separating it from the temporal lobe, this central sulcus separates frontal lobe in front of it from parietal lobe behind it. And very interestingly, the cortex involved in voluntary movement is in front of the central sulcus, and the cortex involved with primary somatic sensation from your body is the gyrus behind the central sulcus. So this is frontal lobe, this is parietal lobe. This is motor cortex in general, and this is sensory cortex in general. So we're just getting our bearings. The frontal lobe is further sort of divided, and it's hard to see the distinction, but this band along here is the superior frontal gyrus. Then we have the middle frontal gyrus and the inferior frontal gyrus. The motor cortex in front of this precentral gyrus, as we call it, because it's in front of the central sulcus,